explosion has risen to 168, and residents are still mourning the death of their loved ones. The National Emergency Management Agency has swiftly responded and now providing critical support to the affected families. NEMA's Director General, Zubaida Umar, has assured that the agency, as directed by the federal government, is doing everything possible to ensure affected victims receive proper care.
A very tragic and catastrophic incident, and it's something that we pray will never happen again. We've visited the hospitals. We've also been at the scene with this delegation from the federal government. And as you can see, the National Emergency Management Agency, in conjunction with the State Emergency Management Agency, has been on ground from when this happened, and we're still on ground. We visited the hospitals today, and we're going to complement the efforts of the state government by providing more drugs to assist.
The accurate number now is 168. This we realize some of them some of them are not together with the population of the first burial. The second scene of the burial, some people were taken to their homes for burial.
With the inauguration of Road Safety Advisory Council by the Vice President about 2 weeks ago, things are going to change. We are going to get more care, more attention, and more funding, so that together we reduce the crashes.
And still in Jigawa State, Governor Umar Namadi has commended President Bola Tinubu for his swift response and commitment to the well-being of victims of the devastating tanker explosion. The governor said the actions of the president demonstrates a sense of concern and responsibility. President Tinubu had sent a high-powered delegation to condole with the people and government of Jigawa State.
The President and the Commander-in-Chief of the Armed Forces of the Federal Republic of Nigeria, Senator Bola Ahmed Tinubu, for the concern he has shown since this thing happened to us in Jigawa State. Mr. President has asked his aide to call me immediately this thing happened, and he sympathized with us and he condoled us. And again, today he has sent a high-powered delegation under the leadership of the Secretary to the Federal Government. They came here, we went around with them since in the morning. They have seen some of the patients in the hospital, and we have also gone to the scene of the incidents. They have condoled the people, and we also went to the palace of the Emir of Ringim. They have condoled the Emir. So I think, and what the message conveyed by the Secretary to the State Government from the President is something that is given us a lot of hope as a Jigawa people.
Away from Jigawa, let's turn now to Kaduna State, where Nigeria's Minister of Defense, Abubakar Badaru, has acknowledged reports of a new terrorist group trying to establish foothold in Sokoto State. The minister, who is on a working visit to Kaduna State, spoke of new collaborative efforts with Niger Republic to strengthen border security and prevent the movement of terrorists.
The Minister of Defense, Abubakar Badaru, on a working visit to Kaduna State. He hopes to evaluate the security situation and uplift the morale of stationed troops. At Kashim Ibrahim House, he commends the state's efforts in supporting counter-terrorism activities.
The police deployment team that is in Kruger is fully sponsored by you. You have been rehabilitating roads so that we have easy access to difficult terrains.
Badaru acknowledges government's awareness of a rising terrorist group in Sokoto and assures that measures are in place to address the threats.
Yes, it's real, but last week you have seen the State Minister of Defense was there to also look at what is happening there, to gather recommendations and see how best we can tackle this. And I think a few weeks ago you have seen our Chief of Defense Staff visit Niger and have meeting with the Nigerian government and to see how we can collaborate and end that movement and tackle the security situation around our borders. And we are working very hard. We are not unaware of what is happening there, and really we will handle it and we will tackle that security situation. And I believe the new collaboration with Niger in fighting those movements, not only for those terrorists, but also for the movements of arms and ammunition and light weapons.
Governor Obasani commends the federal government security initiatives and advocates for increased regional cooperation. He also calls for more military commands under the 1 Division Nigerian Army.
I have been in the forefront of the push for the development of a common strategy and operational plan by northern states to tackle insecurity. Honorable Minister, sir, you may also wish to take a closer look at Operation Safe Haven in Southern General area with a view to determining how it can fit into the present organization.
The minister will proceed to Beningwari and Kachia to finalize plans for the launch of Operation Fansanyama. This move by the Defense Ministry is aimed at addressing insecurity in the northwest and neighboring Niger State. Lupe Asom, TVC News, Kaduna.
Healthcare experts and industry leaders are advocating for a digital revolution in the country's healthcare system. At the Healthcare Providers Association of Nigeria Scientific Conference and Annual General Meeting in Lagos, Professor Akin Abayomi, Lagos State Commissioner for Health, emphasized the need for innovative solutions to tackle the challenges facing Nigeria's healthcare system. Sarah Yeko has details.
Still surviving from a brain drain, Nigeria's healthcare system is on the verge of a digital revolution. Here, top experts and industry leaders at the Healthcare Providers Association are calling for widespread adoption of digital solutions to transform the health sector and ensure massive integration of the vulnerable into the health insurance scheme.
The Lagos State government has demonstrated commitment to the NHIA Act 2020. 2022 and our home previously Lagos State Health Scheme, which was made mandatory from inception.
This is an opportunity for us to reduce the low enrollment rates. It's very important that Nigerians are educated on what health insurance is, on how they can access it, on the benefit that comes with it, and how it can help improve their life. And we can leverage social media for this. Health influencers, health educators, Facebook groups, WhatsApp communities, TikTok, Instagram content cannot be leveraged.
Out of 25 million people living in Lagos, over 1.8 million residents are insured through private health maintenance organization, with an additional 1 million benefiting from public schemes. The government says it is reinvesting in its equity fund to cover vulnerable residents who cannot afford insurance.
And the challenges of health insurance, particularly social health insurance for us in Lagos, are numerous. Our citizens lack an insurance culture. In other words, whatever the case may be, we prefer to wait till there's a need before you secure some kind of advanced protection against a shock, whether it's a car accident, a catastrophe at home, your life, or your health. And so it's important for government to start to introduce and to promote the concept of insurance, not just for health, but across the board.
Health experts say although a regulatory framework will be established to maintain high standards among accredited healthcare providers, Nigerians should adopt digital technology and health insurance. Sarah Ayuku, TVC News, Lagos.
Nigeria has now received more than 800,000 doses of the R21 malaria vaccine out of 1 million expected doses making up the first batch of the vaccine. Health authorities revealed that Kebbi and Bayelsa states will be the first to receive the first phase of the rollout campaign. Nigeria is second after the Central African Republic to receive doses of the R21 malaria vaccine developed by the University of Oxford and the Serum Institute of India this year. The strategic cold store now has a stockpile of the first batch of 824,000 doses of the R21 malaria vaccine to kickstart the nation's malaria vaccine rollout campaign, which is a critical step in the fight against one of the leading causes of death on the continent. Joining me on the news tonight is Executive Director, National Primary Healthcare Development Agency, Moye Aino, who I believe will join us subsequently in this bulletin. But still coming up on the news tonight, Minister of Education commends Borno State government for its